open up the room, right?
Yes.
Okay, so let me go ahead and do that. I will let the people in and you can begin to greet.
If you look up to your left top hand corner, actually we're
Bring
live.
the slides up, Nigel. The
I
beginning
am,
slide.
I am.
Okay.
Welcome. Good morning. Morning,
Good
everyone.
morning. Good
Peace and
morning.
blessings, family. Good morning.
Good
So
morning.
Peace and
Grand Rising.
blessings.
grateful and thankful to be with y'all this on this beautiful morning. If you can, if you don't have some with you, please grab some water. That's my one request. Clinically, over the years, a lot of us are dehydrated. So that's my one request. Please grab some water if you don't have any with you and sip along the way.
Good morning, family. Welcome to our session this morning. Dr. Danett, happy to have you here with us. Uh, we have our community on Facebook. You can welcome them to our session.
Welcome, Facebook. Good morning. Thank you for being here. I'm really excited and glad to be with you this morning. And if you don't have water with you, please grab some water to drink. I believe a lot of us are dehydrated and it just helps everything. So grab some water if you don't have any with you already.
Wake up, everybody. It's time to get up. Wake up, everybody. It's time to get up. Stay woke, stay woke, stay woke. It's time to get up. Stay woke, stay woke, stay woke. It's time to get up. We're healing, we're dealing, we're growing. Together, together, releasing. We're teaching, we're moving. Together, together, we're learning, discerning. We're striving. Together, together, we're leading, connecting, transforming. Together, together.
Dr. Danett, we're ready for you.
All right. All right. Not Irish, but top of the morning to you. So, thank you so much for having me and welcome to Rethinking and Improving Maternal Health for Longevity. My name is Dr. Danett. I am a doctor of acupuncture and traditional Asian medicine, maternal and women's health specialist, author and speaker. And I just want to take a moment before we get into today to just give honor to whatever land that we're on. Um, we're at such an interesting time in history, I believe, as we always have been, but in particular, and so I just like giving honor to the land that we are on, wherever you are, as you are listening in. So before I get into the topic, I always feel like it's a bit important to know a little bit about me. Like before buy a book or you're reading an article, you're like, for me at least, I'm like, well, who is this? So, I'm the daughter of a sharecropper. No, I'm just joking. I, I, let's see. So my healing journey began many years ago, a long time ago. But you know, something that is of particular significance. I was born in Queens. Shout out to Queens. And let's see. So after I got out of college a while ago, one of my good friends suggested that I go for acupuncture. I wasn't really into needles. I was like, I don't know about that, but I trusted this person, and so I went, and so I would go for sessions, and it was like one of the most transformative and amazing experiences for me. And so I was like, wow, I got to learn this. I want to learn how to assist people with this. And so that was actually back in 98. And there was acupuncture is actually a part of a whole system of traditional Asian medicine. And I don't want people to be thrown off by that term because, you know, healing is healing. And there's lots and lots of it. We all can benefit from the medicine. Uh, so anyway, so I went ahead and I became an acupuncturist. I finished that training back in 2003. And in my work, I was seeing a lot of women in my practice, in my private practice, and I also got to do some work at some different health clinics. One in particular was a women's health center, and I was like, wow, I really want to learn some more. So I went and I did this postgraduate program in Oregon, which has beautiful air, but is very different than Queens and Brooklyn. And I would fly back and forth, which it was really quite something to do. But I was on this journey to wanting more, to learning more, to really seeing what is it that I could bring the people that I was helping. And so there, my postgraduate work was in women's health and geriatrics. So my whole thing um, has always been, but that really solidified more of what tends to happen and what can we do, if possible, to avert that. In one of the classical texts of traditional Asian medicine called the Yellow Emperor's Classic, it talks about, you know, different levels to healing and, what we want to try to do is have weapons built before war, right? Like if there's a war happening, if a war has been forged, that's not the time to build weapons. So my whole thing has really been about prevention. So anyway, fast forward, I also got to do some teaching at an acupuncture college in obstetrics and gynecology, and along the way I got pregnant. And after I had well, at the labor of my beautiful son, it was actually very intense. Like I had a complete tear, I hemorrhaged. Um, but I was like on this mission to like keep going, even though I was told to fall back. But I didn't know what that meant. Sometimes, someone can tell you something and you're like, okay, but you don't know what that means. Has that ever happened to any of you where somebody gives you advice, it sounds good, you feel like wow, that's some great advice, but how do you put that into action? Anybody ever feel like that? Oh my. Yes, honey. Do me a favor, please. Just give me till 9. No, 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 no. Don't change my name on here. Okay. Come on, sweetie pie. I'll be with you a little bit. All right. Okay, I'm gonna keep going. How many of you has this happened to, where your child insists on changing who's better at technology than you. No, no, that can't. Ha ha ha. Oh, except I don't know how to fix this. Gloria's son. It's my lovely Leo. My lovely Leo in the house. Uh-oh.
We're getting a reverb. Is your try speaking? I think it went away.
Mm-mm.
Wow.
Can you fix this, honey? Yes, I experienced advice like that. Thank you. Thank you for fixing it, and then you can go watch. You can go watch, honey.
I think you're muted. Okay.
Is it fixed, Gloria's son? Okay,
Yes.
please just leave it, honey. Okay. Be glad you can watch. You won't get to watch tomorrow. Okay. So just leave it. Okay. Please. Thank you. Okay. Okay. Thank you, honey. Please just go do your morning stuff, please. Thank you. All right. Cheryl, thank you for your pre-advice. So, yes. So anyway, so 5 months, he was 5 months, this one here, he was 5 months, and then we had to go back on a newborn. Good morning, Denise. We had to go back on a newborn breastfeeding schedule, and so we are mothers, and it happens. Yes. Um, we had to go back on a newborn breastfeeding schedule, and so his health improved and my health plummeted. And so I didn't know. Gloria, son, I'm really going to ask you to not do that now. Okay? Um, all right. Really nice. I do have help here. I do have help. Listen, if you want to be able to go back on with Naeem and stuff later, don't come back right now. I'll let you know. Okay? The bridge between what we got and what we give sometimes, right? So anyway, long story short, I my health really went down. Like it really went down, and it went down in a way that I didn't know could happen because I had done, so many years of working with women around their health, and I just didn't know that something so significant could occur. And it was, it was to the point where I was having like repeated, thank you. I was having repeated infections. Like I took more antibiotics at that point than I had ever throughout my life. I, I had gotten a diagnosis for autoimmune condition. I had like all these things happen with my teeth. Like my immune system and everything really, really went down. And so, my energy was really low. It was really, really, really bad. And so, one of my friends, she sent me this article about postnatal depletion, which I had never heard about. And that opened my eyes to thinking more about what can go on for mothers and what can go on for their health. So, and so I was like, if I get to the other side of this, because there were questions, with how much I was dealing with, if I was going to get to the other side of it, I was like, I am going to write about this experience, so that, the things that I wish I would have known other mothers can know about. Okay, honey, we're on our way to no Super Bowl. Okay, okay, come back, and that's it. I'm pulling out the thread. So I wrote a book about it called The Taste of Our Own Medicine, thankfully. And and then it just began this whole passion of like, what goes on for mothers. And you know, at the time that I was doing the research for my book, there was um, there wasn't a whole lot going on about maternal health. Oh yes, sure. There wasn't a whole lot. Hi, Zakia. Thank you. Um, there wasn't a whole lot of talk at that time. And actually, one of my um, I had a business coach. He was like, maternal health. I don't know about that. You know. And then a couple of years later, yes. And then Shrezikia, and then a couple of years later, you know, it's like everywhere about like, you know, Black maternal mortality. And, um, you know, so I really feel like for things to shift, there are some key things that we may not always think of in terms of improving maternal health. And so that's what we're going to talk about. So slide, please. I'm going to check the chat right quick. If I missed anything. Yeah, yeah, yeah. Good. Yep. Some people say, yep, they have experienced that. Yep. All right. So you can go to the next slide, please. Right. So I think, you know, so part of my training with traditional Asian medicine is that we really are thinking about things from the root. And so, in terms of thinking about maternal health and specifically for Black women and specifically or African American women, as we think about the United States in particular, and you know, much love and respect to anybody who is tuning in from around the globe at this time, but I'm just going to focus on this because I think it's important. I think it's important for women everywhere, and so I'm talking from my experience and research here. But so, how can we have something go well if the roots of it were poisonous, right? And so we can, but I think we have to be aware of the start and the roots of it. So from slavery, even though our history is, we have a legacy long before that, but particularly in terms of thinking about our history here and what the different things that went on during slavery. For instance, right, you have a baby and then you have to be back, you know, on the field very soon afterwards, like how that became ingrained, or people around us could get hurt, we could get hurt or killed, right? Patriarchy, right? That the the health system for women as it was created in this country, the roots of it was not created by women. And so I think you have to have the input of the people of who you are making these things, you know, who's going to be affected by things has to have that input, and it wasn't. And so from that, we now have a lot of what I think are resulting critiques of what it is that should happen when you're a mother, even that you need to be a mother, right? If you have that within you and that's something that you really want to do, or it just happens and you're like, hey, let's go with it. But there's so many different narratives around motherhood that when we step into it, and even in terms of the health system and the culture of it, that we don't, I believe at this time, get to come into it from more of a natural um, standpoint. We don't really just get to have that. So, can anybody say like some different narratives that they've heard about motherhood or birth or anything like that that they think are not helpful, poisonous, anything along the spectrum? Anybody have anything before I go into to
I'll start off. Good morning, Doc. How
good
you doing?
morning.
This is Shawnee. How are
Hey.
you? Hey, how are you? Um,
So grateful for
so
you.
I was chilling out this morning, but I was like, let me come on and support. Um, so I can start off with the narrative from us being enslaved, that history. So just viewing us as animals And I was watching, I can't remember what I was watching. Oh, I was watching Harriet, the movie that was done. I'm trying to think of what year it was. I think it was 2019. But they were calling the babies that were being born foal, like what you would call an animal. And they called the men bucks, and women were referred to as wenches. And of course, the classic use of the N word to refer to us. But there were a lot of terminologies that were used that were associated with breeding animals. And so a woman would be looked at like an object, her hips, her breasts, her teeth, and they would determine her worth based on her physicality and what she could potentially produce. And the other thing that comes to me is like, being pregnant and having to work from sun up to sundown, and then giving birth and literally having to shortly thereafter go back to work. And then the most heinous, and I just saw an image of this the other day, is that a Black woman could have her baby and be breastfeeding her babies, but if the white slave owner, the wife, had her baby, then that baby would take precedence over the Black woman's baby, and the sister would have to breastfeed the master's children over and against her own. So lots of layers for me there. I mean, I know you have patriarchy. I could talk all day about that one too, but I just wanted to open up about this historical framework and just how we've been viewed and how it's playing out with regard to Black maternal health today. So, thank you for this conversation. It's a necessary one, and this history lives in our bodies. And so if we don't talk about it and transform it, then we're going to succumb to some of the physical, emotional, spiritual things that come up when we carry trauma, and especially generational trauma. I'm complete.
Yes, ma'am. Thank you, Shawnee. All of that. Yes. Uh, see. So Denise said Black women have high pain tolerance, right? We could take it. With slavery, Zakia says with slavery having children taken away at birth. Taisha said the same thing. She was going to say the same thing that Denise said. I also heard we were built different, therefore we are stronger than men. Taisha says, and Cheryl says, during enslavement, we Black women could drop a baby, and it was such a simple matter that we could continue picking cotton, right? That we would be able to breastfeed immediately at birth, and it would be easy. And from Facebook, Laura Joseph, Black women are thought of as breeders. Yep, that we should be fine right after birth. Exactly. And so with all of this, I mean, it seems ridiculous to say, but it's so important. Is this was never a luxury, but it can sound like a luxury now. Is where were we in this? Right? It's about everybody else. It's about us getting back. It's about us not even being human, right? And so you just have the baby, and you should just be able to get back to work, to whatever that you're doing, whatever to be able to produce more, right? This was all about production and economics and all of that. And so, I think that it's extremely important that the resulting narratives from this history that we are conscious of, right? So I remember like after I had my son, people were like, oh, hey, when's the next one? And he's like, not even like 2 or 3 months. That's a resulting narrative, I think, in some way from, when you just have a baby and you should just be, getting back to, life as usual. Or, I've heard some men say, oh, well, that's, what your body's created for that. Yes and no. Yes and no. We do have our physiology as women, but not every woman reproduces, not every woman conceives so easily. And, it all depends. So, I just ask as one strategy for rethinking maternal health that as we're engaging with women who aren't mothers yet in terms of, potential pressure to have a baby. um, I rather see what Cheryl says. Um, that in terms of like potential pressure to have a baby, and I see you, Teresa. I'll be right with you. That Oh my goodness, a legend in the house. Amadou, thank you. That we that we maintain ourselves, and that in terms of like the conversations that we're having, the things that just come out as we're talking to women who aren't mothers yet, or women who are mothers, or whatever, that even in just in our conversation with young women, that we have it be where it's more of that for there's space for their decisions around what it is that they want to do, and that there's space in the language, so that we're not necessarily that we're getting to let go of history, and getting to really give young women and mothers the opportunity and the space to get to have their experience without the holds from before, right? We have that in the system, but our part, because it can be so huge, that I believe we can do, is being conscious, if we're not already, of our dialogues that we have. So let's see what's happening in the chat. I cannot, when folks say that and try to push your life along with their expectations. Yes, Cheryl. At hospital discharge, some say see you next year, right? Oh my goodness. Wild, right? Also, systemic way, they want Black women to labor naturally, clamp down legs, tied to beds. Yes, our bodies need healing after babies. Yes, Teresa, exactly, exactly, all of that. So can we go? Oh, Teresa?
Yes, hi. I had a baby. I said it before a while ago, but I had a baby at 16, and I had a C-section at 16, and I actually didn't realize the trauma of what I was experiencing until last year when I started doing the wake up, and they was talking about maternal stuff and what happens during pregnancy, and it actually affected me. Having a baby at such a young age, and then dealing with my parent, just taking over the baby after I had the baby. I lost like the baby and a part of me, and so it did affect me, and I didn't realize until last year how much it affected me and my son. And I'm just grateful that our relationship is better. But just thinking about having a baby at 16 and having to get a C-section, I never, even my parents didn't even know the question, like they just told him, oh, well, if you don't do it, she's going to die. That's all that they said. It was no one around to say, well, like other resources or what could I do, to get better. But, and then even when I was having a baby, they were not gentle. It was like, they were like pulling my legs apart and I'm screaming, I'm telling them, you're hurting me. And it's like, oh, it's going to be okay, mother, and it was like just disregard of, what I was going through. And then I actually didn't see my child for like 2 days because, the cut was horrendous and I couldn't even, and it was like, there's days sometime when, way like years after I was still having pain in that same area, not realize that, that could affect, that could have affected, what, my body's even dealing with right now. So I really don't know because the way we were handled, even when I was younger, when they get examined, as a young girl, I told the man he was too, the GYN, he was too, teenager get, they do, exams for teenagers. I told him that, he was being too rough. He told me, well, that's not what you say when the man is, having sex with you. And I was like, really? I was like, I was in shock. I didn't even know to even go home to tell my mother that, what this man was saying. I just kept that to myself, but it was like, it's just so much stuff that's said, in those areas, of women of color that, we're so disrespected in these areas. And so, I'm just grateful for being around a family who's teaching me to respect and honor myself like never before. And I'm just thankful and I'm complete.
Thank you, Teresa. Thank you so much for sharing that. Yeah, there's so much. I'm so thankful for this community, and that, for you getting to get to heal. And one of the things that I do with that I recommend, because the thing that happens, and I'm going to possibly get into this a little later, but I'll say something about it now, is some of the cuts that happen, the tears, the surgeries, they go sometimes along channels that meridians, as we refer to them in traditional Asian medicine, and that can affect um, health. And so there are herbs sometimes that we'll use to like help along the channels. And one of the things that I regularly make sure with when I'm doing one-on-one work is to make sure that women have like good GYNs, if they're pregnant, OBs, or they're midwife. You know, when it's a midwife, there's no worry. I'm like, yes, but you know, because many times for women, not usually when they're pregnant, but that then affects an already challenging relationship with having medical care. And you know, I've seen women over the years who haven't gone for GYN visit in years because of their negative experiences, and you know, I know what I experienced as a young woman, like you know, having a GYN that was totally you know, disrespectful, and I was like, you know what, I'm not doing this. And so it's really great. You know, there are some amazing GYNs, OBs out there, and it's great to know that midwives also do well women's care visits. So I have plenty of patients who I'm like, hey, check out a midwife as well because of the understanding that's there. One, but let's see. Yes, yes, yes. It's regarding of what the woman is saying is happening to her. I'm a designer. Someone who had a baby at 6 and they died. They said at the hospital that she believes that they killed her baby at least. Yeah, it's a war. It's a war, but we are we are working on it, and I believe all of the work that we're each doing is helping. So yeah. Um, so uh, yep, Taisha.
Good morning. Thank you. So I wanted to kind of piggyback off of what Teresa was saying. In 2001, when I was pregnant with my oldest, I became obsessed with a reality TV show on TLC, and it was based in a hospital. It was a women's hospital, and I don't remember the name of the show. I think like Baby Love or something. Anyway, there were a lot of teenagers going through this hospital that they showcased. And what was explained, the doctors, when it came time for the decision of C-section, what was explained was the teenagers, the young woman's birth canal was too narrow for a baby to go through because labor was long, or they were having trouble pushing. So the doctors would result to C-section, just to cut the labor amount of time down, and that was always the excuse. I remember because at the time I was 20 years old. I'm not far from 16. Of course, my impressionable mind, I'm saying, oh, how would I be, you know, when it's time for me to labor? And but listening to Teresa and other women's story in space, and it was of race with these young women, but the majority were African American through this hospital. And I just have visions. Sometimes the girls would be alone, so the nurses would be with them, or the fathers, just the father and the mother, and the father's mother, and the girls' parents or family side would be there. And I can just imagine 16 or 15 going through this. And the other thing I wanted to ask you about was the women, because that comment that Amadou Ma said, people say, see you next year. What about the women who want to have, who allow their bodies to have children every year? And what I mean by allowing, there was another reality show with a Caucasian family who's had, I think she's up to 15 children now. But and that was on a yearly, and she's had twins. I think she had 2 sets of twins in that. And that was on a yearly cycle that she was having children. And then I do know in Portland, Texas, of a Mexican family, because it's not just Caucasians, or a Mexican family who did, who again, I think is up to 12 children. And she had lost one, for whatever reasons. And another child is special needs. Um, but that was my question regarding maternal health. Is that healthy? Because but and when I mean allow, they allow, and they were let God bless them with these children, and that's fine. But regarding their bodies, do you think that could be healthy?
Thank you for your question and for sharing. I think it's complicated. Like for certain, um, for some women, not every woman, but well, I'll say this in terms of things that can cause health issues. Um, too many children back to back can cause health issues for certain women. Now, my grandmother, God rest her spirit, Beatrice Hunter, St. Simon's Island, Georgia, Beachy in the house. Um, she she birthed 12, one passed as a baby. And they were back to back. She had a farm, she had her women, she had her sisters there, she had her her vegetables, her herbs, she had everything there. And so that was kind of like her life, that was I don't think, I think it depends on where we're at in history and that individual woman. I think that for many women, there's not even enough space as we think about solutions to realize that we do have a choice in it, right? For some women, it's just like part of the narrative, right? That I was saying in terms of like for rethinking solutions, um, in terms of rethinking solutions is um, is is changing, what it is that it's believed that that we should do as women. And so I think that for some women it isn't the healthiest thing to do, but I think it depends on the woman, right? I feel like for a woman, if she's like, this is what I really want to do, like inside, like this is what I want to do, then I'm like, whatever the woman wants to do, I feel like let's support her in that. But I think that we're still working to make sure that how much are those narratives playing into that? And sometimes, that's a deeper thing. I think even like motherhood, there can be like ego that gets attached with it too, right? And so there's a whole lot of different things. So to answer your question, yes, for some women, it can definitely cause health issues. But I think that, if it's something that a woman really wants to do, I'm down for supporting her with it, but I think in the interim, what we have to do is to continue to work to cleanse the airways and the narratives so that to women have more space to actually figure out what it is that they really want. So I'm just going to check in with Facebook right now before we move on to the next slide. So many beautiful things going on in the chat. Laura Joseph says we tend to work even when we are seriously ill, and the repercussions of that are physical and mental health are detrimental. Yes, yes, that strong Black woman narrative, right? I saw someone say that before in the chat. I don't know if it was you, but it's something else. Yes, yes. So we're gonna go back to the slides for some more to go over some more solutions. Yes, thank you, Ted.
Dr.
Yes,
Danett.
yes, sir.
Yes. Um, we admin here to support you. So if we're gonna pull in anything from Facebook, we can ask Charmaine to bring it in for you, so you don't have to worry about going into Facebook and reading it for
Okay.
yourself.
Yeah, she can just say it. That'd be great.
Yeah,
Thank
we just want you to focus on your presentation, make it nice and smooth. You're doing amazing. And
Okay.
Charmaine, myself, and Nigel, we've got you.
All right. Thank you so much. Thank you.
You're welcome.
So here we are with the second um, part to rethinking maternal health, right? So how can something as physical as labor not have the potential to have physical effects on the body, right? Like I feel like this is huge. It's huge. And it's something that is getting more conversation, but there's maternal mortality, right? But there's a spectrum, right? There's the issues that can happen with women as a result of um, of giving birth, and the result, I believe, also of being a mother and not necessarily, if you haven't figured out to have community and support around you, and all the different things, the different layers that we deal with, for us, Black and Brown um, women, just the different things that we deal with in terms of other disparities. So I think that it's really important as we think maternal health to remember that there are physical effects that can happen on the body, um, that yes, that can happen, because lots of times when after a mother's giving birth, and you know if she's not feeling well, what's the thing that people usually say that she has? The most common thing is, right, the baby blues, postpartum depression, which is extremely real, right? But there has not, from what I've seen up until this point, been a whole space and a conversation for, yes, postpartum, for a whole space and a conversation for the physical effects that can happen. Like, right. So that kind of goes back to that narrative that if you're not feeling so well after you've had a baby, oh, you probably, you know, have postpartum depression, which again is very real, right? But it there are physical things as well that can go on. And obviously, I won't say obviously because people don't always think about it like this, but if you, from traditional Asian medicine standpoint, like if you've lost a certain amount of blood, or if certain channels have been affected, or if you've had a long labor, that can be depleting to your chi, or based off of what your own nutritional or community support or whatever that is, these things can affect health physically. So I think it's really important that, as we rethink maternal health, that we realize that there are physical things that can affect mothers, and that if a mother's saying she's not feeling so great, right, that it's important to also remember that in addition to postpartum depression, that there are physical things. We could go to the next slide. Thank you. So there's a condition called postnatal depletion, which I mentioned that I didn't know anything about until I was dealing with the after effects of having my son. And yes, Denise, so true, right? Also referred to as depleted mother syndrome, postpartum exhaustion. Symptoms can include memory disturbances, difficulty concentrating, emotional fluctuations, hormonal balances, fatigue, joint issues, skin issues, bladder problems, and a host of other ailments, right? So I feel like this is a very important part of, as we think maternal health, because for me, as I think about it, it's about looking at a full spectrum of what can happen, right? So actually, I'll come to that point next. So you can go ahead to the next slide, please. Thank you. And so that we consider that maternal health can affect the health of women beyond pregnancy and 12 weeks after birth, right? So I'm really, thankful that there's more talk about, the fourth trimester, right? Which is, being able to make sure that mothers are having, recognizing that a mother still really needs health, needs attention and focus for her health after the baby is born, um, for another 3 months or so, right? But I think that it's important to realize that it's great for those mothers to get it, and there are a bunch of mothers who did not get that, right? And so I have seen in my clinical practice, like women in their 70s who have different health issues. They're like, "Oh, that happened after I had the baby," and it's like, okay, and it never really got addressed. And she's like, "Well," they're like, "Well, I was told that would just happen, and that's it." So we kind of settle into the different things that can happen, whether it's incontinence, whether it's hemorrhoids that can, become progressively worse, whether it's joint issues, and these things only get worse when they're not addressed. And so I think it's really, really important that we realize that, again, going back to the narrative, it's not just you have the baby and that's it. If your health is not getting supported, and there's not the realization that there are physical things that can happen that can be addressed, then these things can continue on, and still affect women many years after they've had the baby. I just want to see the next slide, and then I'll come, and then um, I'll come to here. Right. So I love this quote. It's in my book too, from the Childbirth Connection in 2017. While childbearing women and programs and policies for them focus extensively on care during pregnancy and around the time of birth, considerably less attention is given to women's postpartum health, including access to high quality care and coordinated services after birth. However, postpartum maternal health influences women's lifetime risk of chronic disease, health in subsequent pregnancies, family functioning, and the well-being of children and other family members, right? So I don't know, because we're still putting together, right, the statistics, right? Because there weren't maternal health statistics, right? Like things are just kind of like being put together because of that narrative, right? Because we weren't involved in the forming of women's health in this country, and because of racial disparities. So, but nevertheless, I believe that it's really important, because if we have so I like giving this as an example, right? Let's say someone goes off to the Iraq war, right? And some people don't make it back from that war, but people understand that if you've gone to that war, you can come back potentially with some sort of traumas, with some sort of things that may affect affect your life just ongoing, right? I don't think that we're at the point where that is necessarily um, just part of the culture and communication around maternal health, right? That there are things that need to be addressed, and that this is a beautiful and amazing and transformative experience, right? Giving birth. It's a choice that women get to make, though, and um, it's also something that can affect a woman's life for the rest of her life, right? And so it's maternal mortality, but it's also thinking, I think, as well about maternal morbidity, which is along the lines of the different ways that women's health can be affected, and then also as part of that, as part of that spectrum, just there being more awareness around that. So let's see.
So, Dr.
Yeah.
Danett, there are some messages in the chat that I want to share with you in the community, but I also wanted to let you know that it is 7:54, and we
Yes.
know that some people need to leave at this time.
Yes.
So if you wanted to thank them for coming or say
Yes.
something to them before they leave, you can do that, and then I will let you know what's in the chat.
Yes. Thank you so much to those who are here who have to leave. I'm just totally honored to get to be in this space with you. And there's more, you know. I have a website, drdanettdean.com, and on there's a link to my book, A Taste of Our Own Medicine, which 3 vital keys to ending postnatal depletion, nurturing mothers, and improving communities. And we're doing this. We're doing this, and I thank you for the work, whatever it is that that you do. I feel like we're all doing our part to make things more right and just for everyone. And my take with maternal health is also, this is about women's health, right? Like, I focus in on maternal health, but it's a moment in women's health. But I feel like as this shifts, then it's helpful for us women of all ages, and for our families, and for everyone. So
Thank you. Thank you.
Yeah.
So in the chat, there was some acknowledgement and comments about the postpartum period and experiences that women have. Imani shared that there's a lot of emphasis placed on gearing up to the birth, but very little afterwards. Another shared that she worked with a nurse who had postpartum depression, and no one heard her until she threatened to throw her baby out of the window. And it was then that she started to receive the help that she needed. Um, we have another comment that one person says they had hair shedding after their son, after giving birth to a son, and it persisted for 27 years. So there is acknowledgement that there is very little attention paid to women in the afterbirth period of their birthing experience and the effects that that takes. There was a question in here about that period, and it was, is the fourth trimester a period of 3 months or is it longer? So if you could answer that question, and then if you could also answer the question around the first year after birth being a very sensitive and um, just a very sensitive time for women who have given birth because there's starting to be conversation and reports around a full year after a woman has given birth, there is still a risk to her life. So if you could talk to those two questions.
Thank you so much. Um, so yeah, so in terms of the fourth trimester, so because when they say trimesters, it usually means around 3 months. That is what I believe the standard is in terms of the fourth trimester. But I think the fact that there's even this opening of conversation for thinking more about a woman's health afterwards is great, and so is much needed. And so I think that for some people, when they're saying the fourth trimester, like literally it means 3 months, but I think it's giving more space to it being longer than that. So by virtue of the definition, trimester is around 3 months or so. But I think the intention with the conversation around the fourth trimester is looking at the amount of time that a woman may need to be able to heal. And so I think for certain, and this leads into the next question, that 3 months, one season is for some women that might be fine, but I think that there definitely needs to be space for at least a year. And I think it again, it depends on the individual's woman's health. What was her health coming into it? What is her support like? What was her labor like? What are the different things that may have transpired over that year? I was trying to find in my book because I can't find it right offhand, but one of the one of the things that I cited in here was from some research that was done in England. I can't remember the woman's name, but she did like a whole like research and survey, and what she found was that most women felt like they needed a year. I don't know if more research has been done since then, but the most recent research that I had found was that in that particular study, and I don't, that women felt like they needed a year. So yes, and also, and this is a perfect segue into what we're going to focus on next in terms of solutions, is this understanding around our connection with nature, right? And so when we look at a year, right, that gives us an opportunity to literally go through all four seasons, right? And our bodies being able to there we say in traditional Asian medicine that during each season there are certain organ energies that dominate. And so for a woman to get to have a year, I think that's not too much to ask. And if a woman needs more than that, then she should have that also. Because what we find is that there's a flow to nature, right? There's a flow to like to even like trimesters, right? And it's pretty much like a season. And so for a woman to get to go through all seasons to allow her body to get to repair is really important. I think regardless of, I think outside of the country, and one of the things I recommend in my book is that we have to, part of the bill of goods, the the bamboozle that a lot of us have gotten is that, our traditional ways are not good. Like I know for my mother, she was, convinced she needed to have me at a hospital, which was fine. There's nothing wrong with giving birth at a hospital if that's what you choose. But it was basically like what her mother had done was like antiquated, and this is where the modern stuff is at. And basically, your stuff isn't good anymore, right? And so I think that it's really important that, if we have lineage, what did our mothers, our grandmothers, our great grandmothers, what were the herbs, what were the things that they got to do, and that we tap into those things, right? In certain traditions, you have like the sitting month, you have like this whole understanding of you're just gonna not do anything for a month. We're just gonna serve you, and we're gonna have somebody help you with the baby, and you're just gonna relax, you know, and then whatever support is needed after that happens. So I totally feel like a year is needed. I think the woman gets to say, but a year minimum after doing what I believe is the most physical thing that a body can do in terms of reproducing um, is minimum. you know, I think that that's fine. I think that that should just be something that is offered standard as opposed to, what some people get off from work, right? 2 weeks, 3 weeks, they work it the way they need to and then they get back, right? But a lot of this goes back to those narratives and who, has set up the precedent, right, for what it is that we're, what it's made to seem like mothers actually need as opposed to mothers saying what mothers actually need. Funny, right? Not really.
Yeah,
Great topic. Yes, ma'am.
not really funny at all. And it does speak to what you spoke about in the very beginning, which are the systems that are set up. And then also, even when those of us that know that our bodies need rest, because of the programming, I'll call it, we refuse the rest, we refuse the help because, we may think that asking for help makes us look weak or this is not the way it's supposed to be. So we, in addition to dismantling the system, needs to dismantle the beliefs in our head that say it's okay to rest for 9 months. It's okay to stay home with your baby for 9 months and hug them and take all of the help and ask for the help. So I'm going to put up the slides and you can let me know where you'd like to go from here. There are some more comments in the chat, but let me know how you'd like to proceed, how you'd like to move forward.
Sure. I'd like to go through a couple more of the slides, and then we're going to get into one of the solutions where we're going to get to do some qigong.
Perfect.
Yeah. Yeah. I say to my patients, just if you can, nurse and nap. Have somebody bring you some food, right? Nurse and nap. So this is just a review of some solutions as we rethink maternal health, right? Because the foundation that was built was on shaky ground. We question everything. We leave space for effective solutions that may be less widely known, which we're going to talk about in a moment. Change to healthy narratives for women around personal reproductive choices. So these are narratives that can be, I talked about what we say to other women, but they're also what we can say to ourselves. I've seen it, I knew someone who had, I think, 2 children, youngest children, and I was really like, hey, let's get you a doula. No, I got this, how we have to really be willing to look at, and this is hard because it's over time, I feel like what happens is, you know, then we don't want to feel bad. Some people don't want to feel bad. So then it becomes part of our ego. It becomes this thing, I can do this myself, right? As someone said in the chat earlier, like the strong Black woman narrative, and it's like none of that is needed, right? I mean, we feel like it's needed, but it's not actually needed, and it's generally not helpful for the children, our bodies, ourselves, the baby, right? So changing the narratives for women around personal reproductive choices. Consider that women can experience physical health issues postnatally, not just postpartum depression, which I want to make sure that I am saying how real and serious postpartum depression is, right? It was mentioned in the chat, the nurse who was not taken seriously about how she was feeling until she threatened to throw her baby, right? It's very real and serious. When I talk about it, I think that it's important for there to be a wider array of an understanding of what women can experience, that in addition to emotionally, that there are physical things that can be affecting women, and I believe can also affect vice versa, that the physical issues sometimes in terms of the substances that we see as important within the body can affect emotions. And then also the emotional health can also affect physically. So we have to be able to see this spectrum and this integration that have space for that. Consider that labor and postnatal events can affect the health of mothers beyond 3 months after giving birth, right? So this is my kind of wink at like expanding fourth trimester to a year, right? The sister said in the chat, right, that in European countries, right, that a year is just given, right? There's an understanding. We're in a place in the U.S. It's all about right the production. What can you produce? What can you produce? Without so much respect to the the producer, right? It's about the production, right? What have you done? You know, how are you? And we don't even in our dialogues of how are you, we tend to say what we're doing, right? Not how we actually are. So a respected mentor of mine, he would say, hey, we're human beings, right? Not human doings, right? So even bringing it back to just pulling back from the doing, but really how we actually are. And then lastly, doing practices across the board. Well, not lastly, but for the purposes of our conversation, do practices across the board that encourages the body's natural healing intelligence for women and mothers at all ages and stages, such as from traditional Asian medicine. So we're going to get in because there's so much, but I like to keep in mind what are the solutions, right? So before pregnancy, optimal health before conception, right? There are a lot of there's talk a while ago, like I had patients like I'm thinking, or people talking to me like I'm thinking about freezing my eggs. I mean, you can, but you still have to make sure that you're in optimal health because, if you're like, well, as long as my eggs are okay, it's quite expensive. It's good to try to just take care of your health. I mean, it's fine. A woman gets to choose what she wants, but if your eggs are freezing, but you're not frozen, but you're not taking care of yourself, that 2-year old's got a lot of energy. That 1-year old and being up at night with a baby and so forth. So working to have optimal health before the conception. Women who come to me for help with fertility, I'm like, I can do my best to help you, but the whole thing is about you and your health. And I believe the body is an amazing accountant. And if it sees like, okay, we have this to give, then the pregnancy happens. And then if not, then you may need additional assistance. But I think it's really important to emphasize the woman's health as opposed to the bun in the oven, right? As I put it. During pregnancy, Eastern nutrition to strengthen the mother's constitution, acupuncture, acupressure to help prepare the body for birth. I'm a big proponent of, and it doesn't have to be Eastern nutrition. I'm just talking about ways that I have been able to assist um, during pregnancy to help strengthen maternal health. I don't do a whole lot with herbs. I leave that to like the Amadus, the midwives, that. But but in terms of like making sure based off of their individual constitution, which is their unique health print, what can be done to support their bodies, and also there's a system of points that was researched a while ago that I would use to help promote cervical ripening and prepare the body for labor. I'm, this has been more so instructional via virtual since COVID, because I'm only doing virtual work, but I've had, support people doing acupressure on pregnant women, helping them to get ready. Postnatally rebuilding and nourishing herbs for internal and external use. So I'm going to talk about a soup. Well, maybe I'll just talk about it now, right? So for the sister who mentioned about the hair shedding, right? So one of the things that can happen, there are these different hormonal changes, but we just see it in traditional Asian medicine as the hair is a reflection of the blood. And lots of times we lose blood during labor. And so one of the things I actually recommend is a soup that really helped me to get back on my feet and has helped other mothers. But it's not even just limited to people right after giving birth. It's a wonderful tonic just to give overall vitality and also to help nourish the blood, which is a part of what we would call the yin, which is really important for like the functions have importance for our eye health and skin health and so many other things. So the rebuilding is really important. And long term, supporting health with practices like Qigong, which we're about to do, herbal medicine, Eastern nutrition, acupuncture, there should be a U in there, massage, etc. So let me see what's next, please. I have the Qigong. No. Okay, so this is just a tree that just shows the different, yes, that shows the different branches of traditional Asian medicine. It's a lot. We could talk a lot about those, but we're going to be doing a demonstration with one of them. So the exercises. So next slide, please. Okay. There's so much I could talk about, but I want to get to the Qigong, and I know we're at 8:12 here. Thank you, Stacy. Glad you like it. So I have to say this because I think the next one goes right into Qigong. I think it's really important that we remember our connection with nature. And I believe that a lot of our solutions are in nature. And so so many different traditions bring it's called replenish soup earth. And there's so many cultures and so many healing traditions bring it back to like the elements. We are made of the elements. It's one of the reasons why I fell in love with traditional Asian medicine, which is that we have these things within us, right? Like, say, for instance, if someone's like, I always get this, knee pain when it gets cold. Well, we say that there's probably cold that's in your body, right? That there's this way that even though, we're inside and, we can control the lighting and the heat and all of that, that we are intimately connected with nature and that so many of our solutions are there. Whether somebody takes, has to take, different drugs and so forth. But a lot of those drugs are based off of herbs and were originally based off of nature. So we talk about 5 elements: fire, earth, metal, water, wood. And within, there's a whole system to this, but there are lots of different correlations. So right now we are in winter, which correlates with the water element. And I don't want to get too much into this because I could talk for a long time about this, but why it's significant is that, I think that with all the different things that we deal with racial health disparities, with what we see go on, that it can feel like how can we handle all of this? How can we fix all of this? And I do truly believe that there are solutions and things that are happening that we're doing all of the time. But I think it's really important to realize that there's something bigger than all of this that has healing in that nature, right? And so what we're about to do is we're going to do some Qigong that really helps with all of these different elements, but in particular, we're going to be doing some like a move that also helps specifically for this time of year. And I will say, and I guess, if I get to come back, or I'm sure I will, probably, but I mean, I'd love to, but that that I'll get into even more. Like I've created a program around what I've seen be useful for helping women, for helping mothers, pretty much of all ages, be healthy. And so this notion, a lot of it is surrounded around nature. Yay, thank you, Zakia. This whole notion is surrounded around our connections with nature. And so in the series we do qigong. I'll give like herbal bundles that help to strengthen. Oh, thank you, Imani. Um, Things within the herbal bundles that help to promote health for the particular season that we're in, because there's different shifts that happen in our bodies, and I'm sure you notice this. So anybody want to say before we go on to the qigong, ways that you can tell that you're connected with nature? Oh, thank you. Okay, so actually, I'm sorry. I just want to see one more thing because I just want to show there's an acupressure point that we're going to need for the qigong. Sorry about that. Yes, water gives. Hey, Bermuda. That's where my dad is from. Well, actually, he's first generation here. But yes, 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 Akia, we gotta talk. Pink sand, um, muscle pie, right?
So
Um,
while I bring up the slide on the acupuncture, just in answer to your question, I know that I can definitely feel a change with the change of seasons. And
yeah,
I mostly feel it. I mean, I feel it with all of them, but I mostly feel it with the winter
yeah.
season. So I haven't seen any more responses to that question in the chat. So is this the slide that you wanted to see for the acupuncture?
Perfect,
Okay,
perfect.
beautiful.
So we're about to do a qigong demonstration. Yes, to changes to seasons. Yes. So this is a point that is at the bottom of your foot. We rarely needle it. People don't like it when you do. It's rarely used, but it's the only acupuncture point on the bottom of the foot, and it connects to it's the first point on the kidney channel, which we say is the root of all the other organ energies. It affects our reproduction. Affects our brain health. It affects our how we age. It affects so many different things. And so as we do the qigong, I want you to try to bring awareness to this area of your foot. So if you we're going to be paying attention to just feeling our feet on the floor. And when I talk about this point, it is 1/3 of the way between, if you can imagine, at the web of your foot, between the second and third toe. Um, it's about 1/3 of the way down. So we're just going to take about 5 minutes to do this. So I'm going over here now.
So just so that the community knows, Dr. Danett, are you asking everyone to now stand
Yes,
and follow
sorry.
along? Okay, great.
Yes. Gonna say from here. Uh-oh. Yes.
Okay, and you are on camera. I'll go ahead and add the spotlight so that folks can see you.
Okay. Okay, great. I don't know if you can. I think Gloria said change this a little bit. Would you like to? Can you still hear me fine?
Yes, yes, I can
Okay.
hear you and I can see you.
So I'm not going to change anything. Okay, yeah, so if you could please stand up if that's available to you. If not, if you have issue, if it's better for you to sit, sometimes people have heel spurs and that sort of thing, then you can remain seated. And what you want to do is you want to have your feet about hip width distance apart. And so what we're doing now is just a little bit of what's called qigong. Qi is energy, gong is cultivation. And there are many different benefits to Qigong, but what it does is it helps to move the energy, the Qi and blood in our bodies to promote health throughout our different channels and meridians. And it can also, I find it very useful in terms of as a solution towards improving maternal health and women's health and men's health and just overall. So the practice, there's many different forms of it. And so we're just going to do some basic right now. So feet are about hip width distance apart, just a slight bend in your knee. You're doing a slight tuck in your tailbone so that it's flat, just a slight tuck because many of us tend to hyperextend and shoulders are relaxing down. And chin is slightly down. And you're just going to put your hands on your lower abdomen, or what we call your dantian, so that your thumbs rest by your navel. And you can just take some nice deep breaths, as slow as is comfortable for you. And here at our lower abdomen, which we say, so down low also is our kidneys, but our kidney energy, that the more breath we can get into our body, the more our kidney energy is fed, the more the cells in our bodies are fed. And sometimes if we're feeling anxious or sad or any of the different emotions, it can be also that our bodies, we say that our bodies are communicating something to us, and oxygen and Qi always help. I'm sorry, what did Stacy ask?
She asked if it mattered if the right hand was over the left hand.
Great question, great question. So we say it's good to put the right over the left, but some people actually feel if it feels more comfortable to you to do the other way, then that's fine. But left, good question, right over left, unless you feel like that doesn't feel right to you. And what we're going to do is we're going to, if it's available to you, to close your eyes and just feel your feet touching the floor. And know that as your feet are touching the floor, it is touching something that's touching something that's touching the earth. And the earth continues to nourish and support us. And the earth is the biggest antioxidant that there is. And that there are solutions, right? And the earth has it. I'm going to take another nice deep breath in. And we're just going to swing our arms from side to side, like we're a tree in a storm, but our trunk is strong. And we're not really emphasizing movement from our arm, but it's just the turning, the natural effect of our turning our spine. Then you can bring your arms up, take your shoulders, and back down. And then we're going to swing our arms forward and back. Inhale forward if you can. Exhale as your arms come back. If you don't have neck issues and you want, you can add your neck in. You bend your head forward gently as your arms come up and lift up as your arms go back. Good. And what we're going to do is we're just going to do some tapping at our lower back. This is a great thing that you can do during the winter time because it helps to open up and make sure energy is moving and getting circulated at our kidneys. And come down the back of your leg and up the inside of your legs. And you can drop, drop, drop. If you are on your cycle, sit this one out. Just take some nice deep breaths. Good. And what we're going to do is we're just going to go ahead and inhale, bring our arms up, and exhale as we bring our arms down. And inhale as we bring our arms up, and exhale as we bring our arms down. We're going to inhale, bring our arms up, and as we exhale, we're bringing down all this wonderful chi, whatever you need for yourself. Inhale up, exhale down. If it's more peace, then you're bringing more peace down. Inhale up, exhale down. If you feel fine, you can just imagine this wonderful chi energy coming down. One more time, inhale up, exhale down. Good. Now we're going to gather the energy from behind us. Like you're scooping something from behind you and bringing it back to your abdomen, your dantian. And then you can rest your hands back onto your abdomen and take some nice deep breaths here. With the goal of getting your abdomen, your lower abdomen, to be able to move. And for many of us, we started out as babies and belly breathers, and over time, for different reasons, our breath grows and has become more shallow, but our goal is always to be able to get our breath nice and deep and low. And if that doesn't happen right now, that's fine. Remembering this attention back to our feet on the floor is really important, because many times as we're thinking about things, our energy tends to come up, but it's good sometimes to be able to bring our energy to be grounded. Awareness of our feet on the floor, awareness of that kidney 1 point, 1/3 of the way down from the web of our feet between the second and third toe. And when you're ready, you can open your eyes if they're closed, and we're done with our Qigong demonstration. And I'm going back over here. All right. So I know we are at 8:28. Time to wrap it up.
Well, before we wrap up, if you are open to it, why don't we ask maybe 2 people in the community to share how that was for them, how that felt for them? Is
Yeah,
that okay?
please. Yeah, I would love that. I would absolutely love that. Thank you.
Right, great. Denise West, right after it was done, said thank you. So let's see what she is thanking you for. I feel like she's thanking you for that. But Denise, are you willing to come off of mic and share how that was for you, how you experienced the...
Yes, thank you so much. It was peaceful, and it gave me the energy that I didn't necessarily have. So it was a good, particularly morning process for my body, just to be centered on my breath, and as well as my feet really sort of grounded. Usually I'm never without my shoes barefooted, but I was barefooted in this exercise just to really feel the ground. So it was really grounding for me. Thank you.
Oh, beautiful, beautiful.
Thank you, Denise. And I am going to call on Afia. Afia, are you willing to come off of mic and share with us, if you participated in the activity, what you felt?
Thank you for the invitation. I actually am laying in bed, so I didn't stand up. I just did some of the breathing and hands on my lower belly and back. So I don't know if I got it in the complete way that it was offered, but I appreciate the parts that I did get.
Beautiful.
Great. Thank you. Thank you for sharing. So, Dr. Danett, do you want me to go back to, well, Stacy just raised her hand. So do you have time for another share?
For
Do you
me?
want, yes. Would you
Oh
like to?
yeah,
Okay.
yeah.
Stacy will be our last share then. So Stacy, if you can come off of mute and share.
Hi, can you hear me?
Yes.
Okay, sorry, I have two devices, so my face is on the other one. Hi, Dr. Grand Rising. Thank you so much for being
You.
so awesome and having that offering. What I wanted to say is that it felt I love qigong, so it was really I wish I was in the park. I was like, I wish I was in the park under a tree and just getting connected. Even for those few minutes, it always makes a difference to connect with energy and have movement in the morning, and those are practices that I do daily. So it was great just being led, as I'm a yoga teacher and pranic healer, so I do that work, and just having you just like tell me to do it was great instead of me telling me to do it. And one question I have for you regarding the foot, the point, the acupuncture point, because I was being mindful of connecting. I'm not sure what you had said. I didn't get it. What were you saying about that part in the foot? Is that we should think of it or have the intention of? I wasn't sure exactly what you said about the point, so I just wanted
Yeah.
to ask that.
Yes, yes. So, great question. So that point is the only, even though there are different reflex points in terms of points on channels, like that, there are the channels and the meridians that go all over the body. It's the only one that's at the bottom of the foot. And so I'm thinking, over years I've given it so much thought, like, why? It must be super important because the kidneys are super important, right? And so with all of the different functions the kidneys do, the I think that an important part of our healing is being able to have awareness, when we can, of our feet touching the ground. And that point specifically, I believe we are able to receive energy from. And so even if we're not outside in the park, I used to teach East New York, I used to teach a Qigong class out in Von King Park. It's like amazing to get to do Qigong outside and be outside. And, I just still feel like when we have awareness at that point, we can still connect to the earth because we are touching something that's touching the earth. So I hope that answers.
Yes, thank you. Absolutely. Thank you so much for bringing
Yes,
the awareness to that. Thank you.
yes. And I think Kaisha had asked about why not tap. It's about what I've seen is that if we do strong tapping at our inguinal area during qigong, it can make our cycles heavier if you're menstruating. So that's why I said that. That may not happen for everyone, but I'd rather err on the side of caution.
Right. Well, thank you. That's what I thought, but thank you for addressing it.
Yes,
And,
yes.
and can you clarify for the community what area you are talking about? You said the inguinal?
Sure. Like between where your thighs meet your yoni or your pelvis. So it's there was a part where I was saying to drop and to like give a tap to that area, but because it's a powerful area, we have lots of lymph nodes there, and generally speaking, it is a really important area to get to do tapping to help to promote circulation there. But if you're menstruating, because it can promote circulation, it can also increase the flow. So right where the thigh meets your pelvis. Yes,
Thank
right
you
behind
for
the
that. Thank you.
thigh.
I'm going to go ahead and put the slides up so you can share with us your special offer for the community.
Right. Let's do it. Um, yes, so participant number one, yes, one participant will receive a discount code for my upcoming Keeping It in Harmony series value, right? Which Keeping It in Harmony spring series, which as I mentioned, I do something every season. And so in it, there are live qigong classes, although sometimes people, based off their schedule, will just do the replays and get an herbal bundle, and it's a lot of joy. So um, should I say?
Let's John Carl, can you tell us who the participant is for this special offer?
Randomize.
Yes, I
Um,
can. One, two, three, 4, 5. That would be Denise West.
All right, Denise.
I was manifesting that in my brain. So yes, that is a yes.
All right. Yes, excellent. So just email me and I will get you your code. Um, can you put my email is gonna show up, right?
yes, so
Okay,
your email has been dropped in the chat already, but we will get to that slide where all of your contact information is shown in just a moment.
great, great, great. And so I don't know if there was one, I wanted to, there was one with my book up. Is that possible to go back to? Just how I like to close the talk. If not, it's okay.
That might be in the next
Oh,
slide.
okay, okay, gotcha.
So if you want to talk about what's on this slide, we'll get to that. I believe it's in one of the following slides.
Yes, ma'am. So yeah, so links. So the herbs that I mentioned, the soup herbs, the yummy soup herbs, that help to build blood. I have different supplies available, 1 week, monthly, and seasonal. And so, as we're having more warm stuff during the winter, it can be a great way to boost your vitality. And yeah, I mean, it was very helpful to me, and I've seen it helpful to women, and it's not even necessarily just for after giving birth. So that's the link there. If you would like to order, and sign up below, right, for my weekly newsletter, and sign up, then you get a 5-minute energetic recharge video. So it shows you some qigong moves, some grounding moves, and then I go over how to do it, and then there's a video that is with it that you can just do whenever get time. It's pretty. I love it because it's energizing and grounding, and that's not always easy. I find, sometimes we'll take something to get like a bit of energy, but this is something that's both energizing and grounding. And with the weekly newsletter, I send something out. I don't send out a whole lot of things. Sometimes if there's a promotion going on, then there may be like reminders and stuff. But it's generally very concise because I know we get a lot of emails, and it's always very pertinent. And I try to make it like something you can read, get something from, and then implement, help your families with, and keep it moving. Yes, and so these are all my contacts: Facebook, Instagram, phone. Preferred method is email, Dr. Danett at drdanettdean.com. And I also have a YouTube channel, so I have some videos on there. So that's where you can sign up for that. Great.
Great. Let me go to the slide for your book because we passed it. So let me pull that up. And you can tell us about your book and tell us where to find your book while I'm pulling the slide up.
Yes, yes, yes. So my book is called, as I mentioned, A Taste of Our Own Medicine. And this is a quote I love ending on: let us have dialogues with emphasis on the mother, not just during the prenatal period, but afterwards as well. And it's available on Amazon and paperback and Kindle. And also with the soup herbs, I also offer book herb bundles. So sometimes people like to give that to pregnant mamas It's just a nice read. There's videos that you can scan to watch. I'm sure many of you know Mama Moot. She is in there. She's one of the people who I interview, and it's just phenomenal. I think in terms of like what we were able to do with the videos, but also it's an easy read, and so people like it. So I hope you will get to check it out. I think that it's sometimes people see it and they feel like, oh, it's just for mothers, but it's not. This is a community issue, and so in improving, thank you, Imani, in improving our communities, I think it's key. I think mothers are the backbone, and the stronger our backbone is, the stronger our community is.
Yes, well, thank you. I agree, and I think many of us also agree that it's not just maternal health is not just for mothers; it's for our entire community. So thank you for that. I am going to go to our love offering slide, and John Carl is going to share. Um, he's going to share about the love offering.
Thank you, Amaka.
Love offerings. Family, you can send your love offerings at Zelle, QuickPay, Spirit of a Woman Leadership Development at gmail.com, and at Cash App, Spirit of a Woman, $ Spirit of a Woman, with the code 256DB. Dr. Burnett has blessed us this morning with information, a wealth of information, her commitment to deliver it. And at this time, we ask you to give back in the form of money. Money is energy. Money in our acronym is my own energy, my own natural energy yields. And today we're asking for you to donate and send your love offerings. You can do that again at $Spirit of a Woman or Zelle using the email spirit of a SOW leadership development at gmail.com. Again, code 256DB. And we thank you, Dr. Burnett, for, again, the wealth of information you blessed us with for maternal and women's health and well-being. Uh, Thank you so much. And our family here will show up as we always do. And again, we ask you to show up again tomorrow, Monday, February 8th. We have our title here is How Math Saved Our Lives, facilitated by Angela Bell. That's Monday, and that's one of our 30-minute sessions. And then again on Tuesday, build your self-care toolkit. Stay ready. Stay ready versus get ready. That's going to be facilitated by Dion Monsanto. Let's move to the next slide. And here we see our Wake Up Everybody schedule. We have Zoom live workshops Sundays, Tuesdays, and Thursdays from 7 a.m. to 8:30 a.m. That's our 90-minute scheduling. And on Monday and Wednesdays, it's a 30-minute session from 7 a.m. to 7:30 a.m. And you can watch and view these presentations live on Facebook in our community group. And stay in touch, everyone. We thank you for joining us this morning. We want you to come back. Come back. We want you registered so that we can keep you abreast of what's happening in the community and our development. We're growing. You can register at bit.ly/wake up movement. And on Facebook, you can register at bit.ly/WUE community. You can also find us on Instagram at Wake Up Everybody Virtual and on YouTube at bit.ly/WUE on YouTube. And again, our email is info.wakeupseries@gmail.com.
John, can I just say thank y'all so much? Y'all were just an absolute honor and pleasure to work with. Y'all are, amazing. I was thinking about it. It's kind of like, if you end up with like James Brown's band, or like, you have to do
We
much.
are we are
Y'all
so
going on.
grateful to have you, Dr. Burnett. And now
Wait,
we
one
as a
second,
community,
John. One
yeah,
second, if I may add,
of course.
for everyone in the community to go on Facebook page and just drop in the chat in the on the Facebook page what you got out of today's session, what came up for you, what questions you have. Let's get that Facebook page energy. Let's get that energy flowing.
Absolutely, absolutely. Thank you, Charmaine, for mentioning that. Uh, and now, Dr. Burnett, what we're gonna do is Danett. I'm sorry, don't want to mess that up. Dr.
I know
Danett.
what you mean. I know what you're talking
And thank you so much. You're so wonderful. We're gonna ask our community to do what we do as a community and bless our wonderful facilitator, Dr. Danett, with our love
Thank you.
flower.
Thank you, Dr. Danett. You are so awesome. Much abundance and manifestation to you, sister.
Thank you,
Thank you,
thank you,
Dr.
thank
Danett.
you.
This was a
Awesome
great
presentation.
conversation.
Thank you for bringing yourself,
I
your
love
son,
Appreciate
David.
it.
Thank you. This conversation was
And it was
needed, and it
nice,
needs to
Sister
continue.
Gloria.
These
Love you.
conversations
Spreading
about
this word
women,
and
women's health,
integrating you in
It
God's
was
word.
wonderful
women's labor and
sharing my
delivery.
health.
Thank
Thank
you
you
This
so
so
is
much.
much.
Thank you for
purpose.
coming and
So,
giving it
so
all.
much.
You're awesome. You're
Thank
awesome. You're
you,
awesome. We
starting from
appreciate
the
you. We
root.
love you. Thank you.
Need more
Thank
doctors to really
you.
raise us up regarding
And
women's
it was
health.
funny.
Thank you so much.
You had to
Thank
pull a
you so
Super
much.
Bowl card for your son to leave you. That was hilarious.
Yeah,
Thank
that's
you,
like a
beautiful.
wild
Have a
card.
Thank you so
blessed
much.
day.
Hey, everybody.
Thank you so much.
Thank you so much.
Thank you.
Love you.
Great energy, great energy, great
Much
energy.
blessings, blessings,
Thank you
blessings.
so
What a
much.
way to start the week.
Take all the love. Spray you with the love, the money, yay. Blessings and abundance to you.
Yes.
Woo!
Yes.
Peace, love, and namaste.